Erectile dysfunction, ED, is a condition that affects men. Erectile dysfunction, and sexual performance issues in general, are far more common than previously recognized. Erectile dysfunction is described as the inability to acquire or maintain an adequate erection for sexual performance on a regular basis. Patients seldom discuss sexual performance difficulties with their family doctor since it is assumed that this is not his role and they are afraid of jeopardizing their image. But do you know the most crucial information about it? Symptoms of erectile dysfunction. The following are some of the most significant symptoms that the patient is experiencing. Having difficulty getting an erection. Having trouble keeping an erection. Lack of sexual desire. Erectile dysfunction causes and risk factors. Sexual performance problems can be caused by a variety of diseases and issues. These elements were previously categorized based on their emotional, psychological, physical, and physical sources. We now know that this classification is wrong, because the soul and the body are inextricably linked and cannot be separated. Erectile dysfunction can be caused by a variety of factors, including the following. Psychological stress, which includes personal issues, marital troubles, and sexual performance anxiety. Diabetes, high blood pressure, hypertension, high blood lipids, calcification, and hardening of the arteries in the body are some of the most frequent disorders. Nerve supply, innervation, issues, such as those caused by a herniated disc in the spine, pelvic surgery, or radiotherapy. Depression and anxiety, two very prevalent conditions with diminished libido and sexual performance as one of their noticeable symptoms. Heart disorders and associated treatments can have a negative impact on sexual performance. A person who has had a heart attack can resume normal sexual activity, but he will require just assistance and encouragement. Drugs, certain medications, such as those listed below, might cause sexual weakness. Medications that act as sedatives. Stomach acid reducing medications. Chemotherapy medicines and hormones of various kinds. Beta blockers are a type of medication that prevents the body from producing beta. Lipid-lowering medications. Diuretics are a type of diuretic. Selective serotonin reuptake inhibitors are a type of selective serotonin reuptake inhibitor. Difficulties of erectile dysfunction. The following are the most serious side effects of erectile dysfunction. Unhappiness with one's sexual life. A lack of self-assurance. Tension and anxiety. The wife's ability to become pregnant is hampered. Diagnosis of erectile dysfunction. The doctor will do various tests, the most essential of which are a complete physical examination, a testosterone test, as well as blood testing, examination of the urine, imaging with ultrasound. A psychological evaluation is required. Treatment for erectile dysfunction. Erectile dysfunction can be treated with a variety of methods, including the following. Medicines are number one. The following drug group is the first line of treatment that is currently known. Sildenafil is a type of erectile dysfunction medication. Vardenafil is a drug that is used to treat erectile dysfunction. Tadalafil is a kind of tadalafil. Avanafil is a type of erectile dysfunction medication. These medications are available in pharmacies, and any doctor can prescribe them under the right circumstances. The following are minimal and temporary side effects of certain medications. Mild flushing of the cheeks. Feelings of dizziness, weakness, and nausea are all symptoms of a small drop in blood pressure. After roughly an hour, most of these sensations subside, although most patients do not experience significant side effects that would cause them to quit taking the medication. It is, however, illegal to combine these medications with nitrate-containing medications, such as those used to improve blood flow in the coronary arteries in heart patients, and it is also illegal to use them for anyone whose physical, medical, or psychological condition prevents them from having sex. 2. Testosterone substitutes. This hormone is thought to be a sexual urge regulator. In some situations of erectile dysfunction, doctors may recommend blood testing to determine testosterone concentration, and if that concentration is found to be low, doctors may recommend testosterone alternatives as a therapy option. Doctors may prescribe a combination of sildenafil and testosterone replacement medication, which has proven to be effective in the past. Direct injection into the penis, corpora cavernosa, where active compounds are injected into the blood arteries, may benefit a person who cannot take one of these drugs or who discovers that it does not help him. 3. Treatments that are uncommon. A vacuum pump can be used to create a strong erection that is maintained in place by a ring at the base of the penis. Another option is to inject alprostadil, a vasodilator, directly into the urethra. This treatment has demonstrated to be effective in recent scientific studies. 4. Surgical procedures. If all of the above-mentioned erectile dysfunction treatment options fail, surgery, such as the implantation of an artificial penis. This procedure is easy and has a high success rate, and the doctor's involvement in the decision-making process and therapeutic measures considerably boosts the odds of success and the therapist's willingness to receive therapy. Revascularization of the penile arteries. Another procedure is available, although it has a low success rate. This operation may be a helpful treatment in a few rare circumstances. The doctor must diagnose these disorders, and in any event, there are clinics dedicated to the treatment of erectile dysfunction in every large hospital. Erectile dysfunction prevention. One of the most significant methods for preventing erectile dysfunction is to managing chronic illnesses. Stay away from anxiety and tension. Checking on a regular basis. Give up smoking. And do not forget to exercise.